Mandy was told that she had a yeast infection and it was actually stage 3 cancer. Do you know that some women in Nova Scotia are waiting over 1,183 days to see a gynecologist? This should never have to happen. This is Mandy Wood. She was a mother, a broadcaster, and actually a victim of our healthcare system, particularly when it comes to women's health and not being heard. She spent most of 2025 advocating for improvements for women's healthcare by sharing her experience publicly. She waited 2 years for a gynecological referral, and by that time it was too late. In 2003, Mandy found a lump in her vulva wall, and for over a year, she was told it was just a yeast infection or even herpes. She was treated with antibiotics and herpes medication. Finally, when she got to see a specialist, it was stage 3 cancer. For those of you who have not heard of vulval cancer, it is a very rare form of cancer, and it's typically caused by the HPV virus, but not exclusively. Early detection of vulval cancer has an 86 to 90% 5-year survival rate. Mandy was known for advocating for mental health using her own experiences to help others. Even when diagnosed with stage 3 cancer, she used this time as a radio host to update her listeners on her cancer journey until the very end. Mandy spent her final months fighting for change, and I think we should continue that legacy on. She wanted every woman to know the signs of vulva cancer and to push for better gynecological care. Tragically, Mandy did pass away this Christmas Day at 45 years old. Please share this to spread awareness for vulvar cancer and to help ensure no more women go unheard. And my last tip is to check yourself. If you have a sore that hasn't healed in 4 weeks, a new lump or thickening of the skin, any itching that wakes you up at night, a change in a genital mole, any skin changes like red or white or darker patches, a lump, a cauliflower growth, tenderness or burning sensation, especially during urination or sexual intercourse, any unusual bleeding or spotting that's not related to your menstrual cycle. These are all signs and symptoms that should alert you to follow up with your care practitioner. A pap smear does not test for vulvar cancer. If your doctor tells you that your tests are normal but your symptoms are still occurring, you need to say these exact words. I would like a punch biopsy to rule out malignancy. Do not let them wait and see for another 6 months. If we have to rely on ourselves, then so be it. I say persistence, insistence, and if anything else, another care provider. My heart goes out to Mandy and her family members at this time, but thank you so much for your advocacy, Mandy, during the time that you had.